Good afternoon, and welcome to the City of Miami Gardens Live Healthy Miami Gardens Facebook Live webinar celebrating Women's History Month. My name is Karen Gray. I am a PR consultant and a member of the Live Healthy Miami Gardens communications team. It's my pleasure to be your moderator this afternoon as we celebrate Women's Health Champions. These are the ladies that did a phenomenal job in helping Miami Gardens navigate through the COVID-19 pandemic. Today we'll share their insights and talk about where we go from here. We look forward to having an informative afternoon filled with lots of valuable information. So welcome. We're so glad that you joined us this afternoon. And let me introduce you to our women, our phenomenal women that are our health champions. To the left, we have Dr. Michelle Powell of POWELL Health Solutions, and she is our family medicine champion. Beside her, we have OLGA Connor from the Florida Department of Health, Miami-Dade County, who is our health advocacy champion. Beside me is Dr. Michelle KIRWAN from the Center for Family and Child Enrichment, and Dr. KIRWAN is our pediatric medicine champion. To my right is Dr. Stephanie Russell from our Father's House of Prayer, and she is our faith-based health and wellness champion. Beside Dr. Russell is LATAYA Dennis Hall, and she is with CARE Inc., and she is also a faith-based health and wellness champion. And our final champion tonight, not least, just in this row, is MYKITA Charity Prime. MYKITA is with KITA Corp., and she is our community health and wellness champion. Welcome, ladies. Congratulations. Let's give ourselves a hand. Fabulous. It's so wonderful to have them here. What we're going to be doing today, we're going to be going through a series of questions and asking each of our recipients to talk about something that's familiar and that we thought would be a good question for you to answer. And then at the end, we'll bring it all together. I have one last question and everybody can jump in on that one. But for the first question, it's going to be about life and life balance. So what I'd like each of you to do is, when I call your name, just give us a brief introduction of who you are and then answer the question. Works for you? Yeah? Everybody? Yes. Fabulous. So it's Women's History Month. One of the most challenging things we face as women is managing work-life balance. In that vein, I will ask all the panelists to quickly introduce themselves and answer this question. How did you manage work-life balance during COVID-19? What were your challenges? How did you work through them? How did you cope without human touch and lack of social intimacy? It's a lot, but it really is all the same thing. So, Dr. Powell, if you just give us a brief introduction and then tell us how you handle that.
My name is Dr. Michelle Powell. I'm a family physician with my company, POWELL Health Solutions. Throughout COVID, from the beginning, we did not close our doors at POWELL Health Solutions. What we did was do some modifications, which we introduced to telehealth, as well as we limited the number of people in the office. But I felt it was really important for us to keep our doors open, because what better time when you need your physician is during something such as COVID. So when you talk about life balance and how did COVID affect us, for my staff, we had to really adjust our engagement, not only with one another. Every day we were taking temperatures in the office of everyone coming in. If anyone started feeling sick, it didn't regardless, it was a temperature or fever, fatigue, changing their taste, we immediately got them home and following the protocols of isolation for the short period of time. I think we need to address, since it's Women's Health Month, a myth that exists, that there's such a thing as balance. Right, ladies? It's a myth. What we as women do, and if I could speak to the ladies, I'm sure they'll have words, is that what we do is put things in priority order. We create what is important, and it may be 90% one day, and the next day it turns into just 10%. And we have to do that at work and we have to do that at home. Yes, the laundry didn't get done that day. And no, we're not folding clothes today. And we're going to eat out. We're not going to cook because it's not going to work with the schedule. And yes, I'm going to give up my workout for 3 days, but I'm going to jump back on it on the 4th day. And it's about what takes priority. And
It's juggling.
it's not just juggling, it's putting importance on what's important. And I think as women, we've learned to do that really well.
Yeah.
And so as far as life balance goes and engagement and touch, yes, it was very different because as a family physician, especially in osteopathic, our hands is how we treat.
Yeah.
We touch people. And guess what I did? I touched people with my gloves. I sure did. I would hold hands with my gloves, you know, and because it was so important. But more importantly, I touched with words. And I think that's what helped all of us and the patients I dealt with. I spoke more to people. I talked more on the phone. I communicated. And we forget that communication is touching also.
Yes, absolutely. Great. So what I heard was prioritizing and not letting yourself get overwhelmed if you didn't finish the task list for the day.
Yes.
And we should still do that, not just because of COVID, we should still do that. It's like the other myth, multitasking.
Yes.
You know, the only thing I know that multitask is a computer chip. And the last time I looked, none of us had that.
And it will crash on you if you have too many windows open.
So Olga, tell us a little bit about yourself.
Well, I work for the Department of Health and I'm the Communications and Legislative Affairs Director, and when COVID started, they announced it in our office. So it was like work, and work. Because the community needed a lot of information. We had to prepare for a lot of questions and we had to continue to work and have the offices open, although some of us work remotely and in the office, both things. So how do you keep it going, balance your life? I'm not that good at balancing my life, but I try. Like the doctor said, to prioritize and do what's important today, and what you can let go for that day. And that's how I do it.
Good. What about you, Dr. KIRWAN?
So I'm Dr. KIRWAN, Dr. Michelle KIRWAN. I'm a pediatrician and Chief Medical Officer at the Center for Family and Child Enrichment in Miami Gardens. And work-life balance, I think Dr. Powell said it best, is really just prioritizing. But I will say in the beginning of the pandemic, the first maybe 6 weeks, most of my staff was working 3 days at home, 2 days in the office. I maintained doing 4 days in the office and 1 day at home just because I was the medical director and had very little help in terms of management. But it was more of a 9 to 5 job for me because the patients were not coming in. And I had great work-life balance in that first 4 to 6 weeks. I was cooking, I was working out more, I was meditating, I was going for walks, juicing. I watched like 3 seasons of Ozark, which I had not watched a series of anything since I started working, as a medical director. So it was a real taste of what work-life balance is supposed to be. And I lost it after we kind of started coming back into the office, but I am determined to get back there.
So did I hear you correctly when you said 9 to 5 gave you that?
9 to 5 gave me that. Yes.
It's true.
Yes, because it was all administrative work at that point, and that is much easier than being a physician, I think.
Absolutely.
In terms of what we do. In terms of the touch, for me, the hardest thing was not being able to hug my parents. And, they're older, they're in their 80s. And so that for me was very scary, especially with COVID. You don't know, will you be able to touch them again? And then on the flip side were my patients, pediatrician and the kids expect hugs, they and you can't hug them. And in the beginning, I didn't really know what to do. I didn't know how much they understood COVID, and then I figured out air hugs and I miss you, I'm giving you a big air hug. But it was really, it's been really hard not to grab them and hug them.
Yeah.
That's just part of being a pediatrician.
So you found a degree of creativity to overcome that.
Yeah, we did fist bumps and all kinds of kind of thing. But yeah.
So before we move on to our last 3, I want to remind everybody to go to livehealthymiamigardens.com for a list of providers that are offering COVID vaccines and flu shot. It's flu season and COVID is not gone. It may have simmered down, but it ain't gone. So please, if you haven't been vaccinated, do yourself a favor and get vaccinated. These women all worked hard to make sure that our community was vaccinated and taking care of one another as it should be. It's a village. So, Dr. Stephanie.
Thank you. So I am Stephanie Russell, Senior Pastor of Our Father's House of Prayer Ministry Church, also community and clergy organized for Faith in Florida, which is also a social justice organization that believes in dismantling discrimination against Black and brown individuals. Question to a pastor, how did you balance? Very, very difficult, very challenging. Because as a pastor, your first priority is you want to make sure that the sheep is satisfied. You want to make sure that they're being fed. And the challenges that we face with not being able to go into the sanctuary, we had to become very creative. And we had services, which is drive up, and praise God, in the parking lot, and an open lot. And that was beneficial to us because it also involved evangelism. Because the community that wouldn't have come inside the building was able to get a word of encouragement. And so that brought a level of help and hope. And we were very grateful to be able to do that and transition from the building to the outside. How did I touch? When I could not physically touch, because I'm a hands-on person even before pastoring, I believe in the power of prayer. And prayer has the ability to travel and to touch where man cannot touch. And this had happened to become a season where we had to rely on our voice to travel and to touch and prayer and declare and decree a thing that we could not physically be there to do. So on one hand, it caused some challenges, and then on the other hand, it caused some strengthening because we were able to manage to do what we couldn't have done or wouldn't have thought about doing had not this pandemic.
Hi everyone, thanks for having me. I'm really excited to be here. My name is LATAYA Dennis Hall, and I'm the Executive Director and Clinical Director at the Center for Advancement, Restoration, and Empowerment. This is an affiliate of Pentecostal Tabernacle, if you're familiar with that church, at 7th Avenue. As a psychotherapist and this whole season of COVID, it was really one of my busiest times. And during the whole pandemic, I really had to focus. We were working throughout the pandemic, so our offices were open. We were in the community. I became an official box lifter, box packer, truck driver, doing all that to ensure that food was mobilized to the community. And then most importantly, our mental health program really ramped up. But the most amazing thing as it relates to finding balance was just being a mom. I have a 13-year-old and a 6-year-old, so I had to become teacher. So I was writing schedules and lesson plans and trying to do all of that. But as Dr. Powell said earlier, it was really exciting to see the opportunities that I had to be able to work out and go for a walk and meditate and do all these wonderful things. But importantly, teaching my clients these new set of skills, that was important as it relates to touching. And because faith is so important to my practice, as and Dr. Steph has said, if we had to really push prior, we had to push therapy and just becoming creative as to helping person understand in the midst of everything that's going on, what are we going to do to approach the challenges that we were faced with. So I really feel blessed to have lived through this crisis and being in the position to have helped my community the way we were able to. So as you ladies, thank you again.
Now, I heard you talk about your children. Did you get them involved in the things you were doing?
Absolutely.
That is such a wonderful thing. It's a great way to teach
Absolutely.
philanthropy and being your brother's keeper.
Yeah, they were at the food bank. They were working at the food bank with me when we had the food bank open, so they were packing and sorting, so absolutely.
Last but not least.
Good afternoon, everyone. I'm MYKITA Cherry Pine. I am a wife, a mother, and a community advocate in the city of Miami Gardens. I'm also a teacher by trade, and I'm a business owner. So this conversation, I can hear everyone's story here because as a mom and as a teacher, I have 4 sons.
Wow.
So automatically, when you get up and I'm getting them dressed for school, and they're like, oh, wait, you're not going to school. What do you mean you're not going to school? What are we going to do? And then they're like, oh, you guys aren't coming back to work, period. And I'm like, what about my students and Zoom? And so the pandemic for me was an eye opener in terms of 24. I don't think I was maximizing my time as best as I could in terms of everything that I'm doing, in terms of community, in terms of being a mom and a teacher. And so for me, the biggest challenge was being forced to slow down. I'm a go. I was in the gym before the pandemic. I stopped going to the gym during the pandemic. I actually wasn't meditating and wasn't taking walks. I was actually like, what am I gonna do? Because my day became consumed with, okay, how can I educate? I'm also on the PT, how can I educate my parents and tell them, no, our children may really need to stay home and be out of, their faces, or what can I do as far as my children? Because my kids, I had a son that would go to school every day and make straight A's, and since the pandemic, I haven't been able to get him back on track because he's so jaded about not having friends and not having that interaction. Yeah, son number 2. So for me, it has just been trying to bring the balance pre/post-COVID. As far as the community, one of the biggest challenges for me was also when the vaccine came out, as far as just making sure that everyone had as much information to make an informed decision as possible. Because as a teacher, I have students and parents, are you vaccinated? Did you vaccinate your kids? What are you doing? As well as some of the seniors and some of my neighbors are asking me as well, you know about this, are you vaccinated? I'm like, I don't really want to tell you what I'm doing because I don't want you to feel like, you have to do what I'm doing. So as far as that, those were my biggest challenges. There is no balance. There is no balance. That's not true. And prioritizing is day by day. I mean, last week I went to the gym every day at 5:30 in the morning. This week, I'm not going to the gym this week. I'm tired, I'm getting sleep. I'm taking echinacea, so I'm drinking tea. So, balance. I always tell my grandmother, you lied to me. You said you married, got kids, you lied. You said everything was gonna, it is day by day. Like even today, I have to pick up a son when I leave here and then go take another one. It's day by day. Yes, so as a woman,
it's constant juggling and balance.
There's
no balance.
There's no balance. There's no juggle. It's just what at this time that I feel what I should be doing. I'm not even like laundry. I cleaned up. Okay, I cleaned up on Monday, but I didn't cook. But I cooked yesterday, so I'm not gonna cook today. Like there's no balance. That
is balance. You're balancing it. It may not.
But it's not intentional.
Like
it's not
intentional.
It's right. What is my heart feeling today? Am I pumping fast enough? Am I pumping going up? So for me, I'm just trying to be the best person that I can be at that moment at that time. It's very simple for me.
Yeah.
I look at what my mom was able to do, and I'm like, I can't do that. You had 2 girls. I have 4 boys. Like, so I mean, I honor, respect all of you women here because I know it is extremely hard to be a woman, mom, daughter, sister, cousin, whatever it is in your capacity, and still care for your community, still care for your patients, my students. It's a lot. So I just wanted to say,
and that is why we're here, to celebrate everyone here because you did so much for this community during COVID. And we want everyone in the community to know what these panel of women did to make sure that Miami Gardens came out ahead during COVID-19. So again, make sure you go to livehealthymiamigardens.com to find out where you can get the list of organizations that are giving out COVID vaccines and the flu shot. So now we're gonna get to more little individual stuff and ask everybody individually. And I'm gonna actually start with you, Dr. Stephanie. Okay, so without your congregation, your usual congregation in attendance during COVID, how did you reinvent your community outreach to better serve them during the lockdown?
I think that, thank God that our congregation is a very flexible congregation. We are not a denomination, so we're not denomination, so we're not boxed into a certain style of service. Therefore, when we were able to go outside into the community, they were more than willing to go. I think our membership increased from being out there. We weren't just out there for service in terms of worship service, but we fed the community on Sundays. We had the COVID drive, the testing sites out there on Sundays. And just kept encouraging the flock, to call one another, to do the best that we could to take care of ourselves so that we can be available to help take care of others.
So that was a change from what you usually did, because now you're getting the people involved. And I heard you say get the flock involved to reach out. So now everyone's doing some outreach. So you're getting a collective, a family. As they say in the African proverb, it's a village. You really got the village motivated and going. And that made a tremendous difference. Do you think you're gonna keep that up now after COVID?
We are because the pull from the community has forced us to do so. And we don't see it as a duty, we see it as a desire.
And a joy.
And a joy, absolutely, because the community needs it.
Yes.
And unfortunately, there are still some people that will not go into a building to have service. And so if we can go where they are, after all, the Lord came, He met us at the point of our needs.
Yeah.
And so therefore, in return, we meet our community at the point of their needs.
And where two or more gathered, it's true.
That's right.
Excellent, excellent. So, Dr. KIRWAN, you're next. Yeah, I know that we kind of went into lockdown March. I closed my office March 13th. I said, go home. And I went home. And it was about 6 to 7 months initially where everybody was just locked down. When the children, did you find when children were more withdrawn, when they were withdrawn from school to quarantine, was there a noticeable difference that you observed in their emotional and mental behavior for those that actually came in to see you during that time?
Yes, I did notice a difference. And also parents, a lot of what I get is through parental report. So the parents also reported differences. And I know for the women here on the panel that have children, you can speak to this as well. But I saw two things. For those children who did not enjoy going to school, who were maybe bullied at school, maybe not popular in school, or school increased their stress and anxiety levels, or just being in that space increased their stress and anxiety levels, they did better. They were more calm. They just felt better having a layer of protection, being the computer between them and other children that they might have had.
So it was actually stress relief.
So for some. Now, for others who were more social, more extroverted, and enjoyed school, that was their social interaction. For those children, it was very difficult, and you saw increased anxiety, increased depression. Overall, I saw a lot of anxiety and depression, a lot of that. And so for all of those children, whether they enjoyed being in school, they didn't enjoy being in school, COVID brought a lot of fear and brought a lot of uncertainty. Just the change in their daily activity, their daily lives, their extracurricular activities, the fear of losing their parents, losing their siblings. It brought a lot of fear, and with that fear came a lot of depression and a lot of anxiety. So I did see a lot of that, and for the parents too, their fear went through the roof, their anxiety went through the roof, and they're sort of a model for their children. So I had to do a lot of talking and coaching parents, and meanwhile I'm freaking out. I'm like, oh my God, my parents are elderly, and I'm worried about, So it was really hard. We all had to just kind of pick up and help each other out and give that advice and try to take that advice, just one foot in front of the other, have faith. I did work praying with families and, and talking about faith, and but it definitely was a challenging time for children, a lot of change in their routine, regardless if they wanted to be in school or not, and that uncertainty is very difficult. Any uncertainty is difficult for youth.
And I hear a common thread here. You ladies were holding up the community in spite of your fear and your doubts and your concern, because of your love for people and love for what you do. You continue to do your best at your job to keep the community whole. And that is just phenomenal. I mean, that's blessings. Blessings abound, and I appreciate you and everything that you did. So if no one has told you, I appreciate you. I wasn't there when you did it, but I appreciate everything that you did. And I'm sure our audience living out there in Miami Gardens appreciated you too. So folks, when you look at this Facebook Live, take note of who these women are and send them a note. Say thank you. Just say thank you. You know? So, Dr. Powell, this is your question. Oh no, actually, I have one for you, Lataye. As a writer, and you didn't say that, but I know you're a writer, okay? Can you tell us if your outreach experiences during COVID, has that inspired you to put pen to paper? And if so, what can we expect to see in the future or shortly?
Wow, absolutely. The pandemic, I mean, I got the opportunity to increase my writing, first of all. But as Dr. Powell mentioned earlier, there were a lot of insecurities that persons were battling with, my own client, mental health clients. It was just a lot of fear, a lot of anxiety. I also work with older clients who were not so attuned to using the social media, but they want to read. So I had to become creative in writing pieces to get to them so that they'll be able to read that. Out of the pandemic, I wrote 2 books. And Dr. Steph would probably relate to this one. It's called Sheep of His Pastures, and it spoke mostly about anxiety and fear, and it also talked about feeling depressed, feeling cast down, and understanding crisis and managing crisis, particularly for the people of God, because here it is that we were seeing, while as a community we were struggling with these mental health issues, you would have thought that the church would have dealt with it with more confidence, but even the people of God were struggling in terms of their faith. And I saw it necessary, because that's a population that I work with a whole lot, that I was going to write this piece. And then I wrote one for the kids called Busy Feet, the Strange Sheep. And it kind of speaks about security, that no matter what is going on, your world may feel uncontrollable, and even yourself may stray. There is a Father that is going to be keeping you and protecting you. So just a lot of psychological material that I had to tap into and start writing because of the needs that I saw from my clients from a psychological perspective.
So we've got Busy Feet, you said?
Busy Feet.
And what was that? And the other was just little notes
Sheep
that
of
you
his
wrote.
pastures.
Sheep of His Pastures.
Yeah.
Fabulous.
And of course, the grief curriculum. I also created a grief curriculum to address the many deaths and dying. I co-authored that with one of my colleagues. It was just a curriculum that helps to deal with grief and loss and those who were struggling. It's a psychoeducational group. So we did a little writing.
That's good. So are these books out now?
Absolutely.
And where can people find them?
Both copies of my book, Busy Feet and Sheep of His Pastures, are at Barnes and Nobles, and they're also on Amazon. They're also on my website at caringonline.org.
Fabulous, fabulous. Good for you. So we have to go out and shop, ladies. And gentlemen. Okay, so Dr. Powell, COVID-19 truly heightened awareness of the underlying health disparities in our communities of color. If you had to give us marching orders, what would they be?
You sure you want to give me? If I were to give marching orders to our communities, the first marching order I would have is to please stop sharing myths. Please just stop sharing myths. Stop sharing untruths. Stop sharing information that is not based in fact. Because I've seen so much death, illness, because fear was perpetrated during this period of time. It was an opportunity for our communities of underserved communities and communities of colors to be sensitized to fear. One of the biggest fear was that this is going to be another Tuskegee experiment.
Exactly.
When the entire world was being vaccinated with the same vaccine.
Exactly.
And it was true, yes, there was experimentation on our people, but we have to understand during COVID, it was a time when the entire world was affected, but there was so much untruth. So my marching order number one, and not just with COVID, for all the health issues that we deal with, to please stop sharing and perpetrating myths. Seek out fact and not just Google page number 1, not even Google page number 2.
Not even Google
I
sometimes.
I want you all to go to legitimate resources. If you're going to do your search, and I love patients coming in with, I read this, and I say, I'm okay with that. But let it not be a hearsay. Let it not be, well, my auntie or my cousin told me that if she heard that, her friend heard that. Let it be based in fact, let it be based in research, and then share that information. That's the first marching order. The second marching order I would give to our people is the mask goes on you first. First. And as women, I want to say this to, especially in Women's Health Month, know you, know them. If you're ill, if you're not taking care of yourself, if you're oversleeping, overworked, not eating, not taking care of your own physical health, not getting the tests you need, not doing your physical examinations, not doing the blood work that you need, not eating the way you're supposed to eat, and you become ill. You become ill.
And you're the caregiver.
You're the caregiver. Who's going to take care of the flock? Who's going to take care of the sheep? I had people taking people to get vaccinations and wasn't getting it for themselves. Taking people to the emergency room, but raging a fever themselves and not going in for themselves.
Right.
So those are the two marching orders. Limit the false facts. Stop sharing those things and take care of yourself first so that you can take care of others. That's how it works. You're going to give from the overflow,
Right.
which means that you actually have to fill the cup first, your cup,
Right.
and then you give.
Yeah.
And so that would be my health message, my women's message,
Yes.
and also for a message for our people.
I love that. You know, when people don't understand that, I tell them, I said, have you ever been on an airplane?
Yes.
Why do you think they tell you to
Yeah.
put the oxygen mask on yourself
That's
first?
right.
Yeah.
Because if you become devoid of oxygen, you can't help anybody.
Anybody.
And it's the same with the body. The body needs oxygen. If it becomes devoid of oxygen and water,
Yes.
you're in for doomsday.
And
So I love that. That is tremendous
And
advice.
and there's nothing wrong with putting up a prayer for yourself.
Exactly. There
Give
should
me
be
strength. So that I can give strength.
Absolutely, absolutely. Once again, folks, these ladies are here sharing their insights and their experiences and their love message to us about what they did during COVID to help Miami Gardens navigate through that trying time. And if you need more information on what Miami Gardens has to offer and Live Healthy Miami Gardens has to offer, please go to livehealthymiamigardens.com, and there is a wealth of information on there about getting vaccinations for COVID. Flu shots, it's still flu season, right? It's still flu season. Flu hasn't gone away, and COVID is still here. I don't know if you heard it, but this morning they said that Omicron is now raging in China again. Yeah, so wear your mask. I still wear mine. So, MYKITA, as a member of the Live Healthy Miami Gardens Sub-Council, what do you know now that you wish the community knew before the pandemic?
Oh, okay. A lot. One thing that, I mean, the power of hand washing
Oh,
is huge. I mean, who would have thought that just a simple hand washing technique, it just, I mean, we tell our kids, we tell wash your hands, but now it's like, you know, everyone's, you know, cover your, like even covering your mouth when you cough, like
yeah.
it's
And
really,
sneeze.
yeah, and sneeze. It's like really, really important. But one thing that I learned a lot about vaccinations. I'm vaccinated, I'm up to date, so are my children, but I had to learn a lot because there were so many conflicting stories out there. So one thing I wish we knew before the pandemic was about vaccinations. And as well as you said, the Tuskegee Airmen and all of that other stuff, there was a fear that was there because of what happened. But I wish we could have had this conversation and these conversations before the pandemic, because it caused a lot of pushback in our community.
And a lot of
With-
lives.
Yes, with the pandemic, we saw a lot of people that were just not with. We were passing out flyers and trying to get them to get vaccinated, or it just wasn't happening. Even now, if you're in the community, people are not opening their doors like that. Seniors, and I don't blame them.
Yeah.
I always tell them, if I was I wouldn't open my door either. My grandchildren, my son can't even visit his grandmother because the oldest, he just got his vaccination. She was like, "You're not coming around so you get vaccinated," and he was upset. I'm like, "Well, you can't get mad at her. It's her choice. She's 75. You're 18. Hello." Okay, so that's the biggest thing that I noticed. I wish we knew more about vaccines before. I wish it would have taken the pandemic to happen for us to get this, for us to want to know this information, because the information was there, right? I go to my doctor, I ask a lot of questions. I know they're sick of me, but just
That's okay. That's
no, but I'm just saying generally, you know, because my family, you know, it's half are vaccinated, half are not. So at the cookouts, it's a lot of arguing, even at functions. My son's school, you know, and something is definitely going on because they're coughing a lot now. We just left, so I wish that we knew more about vaccinations. That's one thing that we learned a lot during this whole episode. And Tamara will tell you in our meetings, it's gotten heated. Because, you know, it's like you need to do this, like you can't tell me what to do, you know? And how it was publicized. I wish that when it came into play as well. So people could have made the informed
It's
decision.
delivery and reception of the message.
Yeah.
And we have to move away from what you need to do to this works better.
Yes.
You know, let's try this. This because with all the misinformation out there, people are like this.
Yeah.
So when you tell me what I need to do, I'm gonna tell you I don't need to do that. But if you say to me, you know, this method works better and this is what's worked for so many, do you have any questions? And let's have that conversation. And that's a different approach that people will be more willing to open up and maybe learn, because everything is based on fear and misinformation.
Yeah.
So, Miss Olga, you're gonna wrap it up for us. Since you're the health advocacy champion, what words of inspiration and encouragement can you give us as we learn to live with the new normal?
Well, I think we have to live with a new normal because there's a lot of changes on what we do and how we do it. First of all, there's people that have lost relatives and friends and their life are never gonna be the same. Then we did work differently than we did before. We were like people are working remotely and people might not wanna come back.
Oh, they don't.
Or they might want to do like a hybrid, so we've learned that works and people continue to work and were doing what they were supposed to do. And we also learned that there are agencies that agencies were able to change what they were doing. Like for example, they had senior centers where people came to eat. So they were delivering the meals to their homes, not Meals on Wheels because they were already doing that, but extra meals, the meals for the people that were there. So we've learned things that could be done different. We also learned, like the doctor said, that people were providing misinformation that some people died because of that.
A lot of people.
Yes, a lot of people. I mean, you were telling people this, but no, I heard like somebody was gonna put a chip
I know.
in your when they gave you the vaccine.
Yeah.
So it wasn't.
Here's a chip. Some people
That's
have
what
two of
I'm
them.
telling you. No, that's what
Yeah.
exactly.
Some people have two of them.
That's the
Here's
track.
my locator.
Yeah.
And if you have
And everybody's got it.
and the tiles that they sell, the Apple tiles or whatever you put there, they follow you the whole.
Everywhere.
So people were saying all of that, and it became very difficult. And then we also learned that community working together was very important because there was no government agency, there was no city, everybody had to work together and do whatever needed to be done. And I applaud Miami Gardens because they would call the health department for information and we had people come and speak to the community. So they were very helpful during the pandemic, and they're always helpful with the health information that they provide the people here. So I see a different whatever you call ballpark or a different place completely that we have changed and things are not gonna go back to normal, and hopefully we're not gonna have any more pandemics, and it's not coming back here because they're saying in England and UK and China, they were saying that on the news.
Yeah.
So that's how I see it. I mean, I think the community came together as best as ever, that to try to do what they had to do to save people.
So what I'm hearing is keep doing what we're doing, keep coming together and keep working together, keep checking on your neighbor, keep checking on everybody and making sure. You know, there are a lot of people that live by themselves and we need to check on them to make sure they're okay. I know of a lady right here in Miami Gardens, she had a stroke. And she was there for days because she lived by herself. And she passed away because by the time they found her, it was too late to get any help. So keep checking on everybody. If you don't see them come out for a day, knock on the door. If they don't answer, call the city, do a well check. You've got a great fire department, a great police department. They will come out and do a well check. And keep watching and looking what Miami Gardens is doing because they really do care about everyone in this community. So before we go, I have one more question, okay? And anybody can jump in for this last question. Ladies, why is it, in your opinion, important for community partners to take action during times of crisis? Because I think everybody here is a community partner. So why is it important for community partners to take action during times of crisis? And not only a pandemic, because crises happen all the time. So part of that is we have to be more astute, more in tune, so that when crises start to raise their head, we don't overlook them, and then they become broader and harder to manage. So anybody can go.
I want to say that without a partnership and with people with different backgrounds and different degrees or different, whatever they did in the world is different, you're never going to conquer anything. You're never going to be able to. You need every partner because everybody has a different audience.
And a different job, right?
A different job, a different audience, and a different information to give. So I see that as the most important thing.
The partners getting involved and taking action. Anybody else?
I think together resources to maximize outcomes.
Yes.
Because when you're doing something, you want the outcome to be effective. You want it to reach as many as you can. You really want the community to say, or whoever you're helping, that this really helped me. So purposeful partnership, I think, is great because it's going to maximize
And
the outcomes. Correct.
Absolutely.
Also, I think that when we partner and the community is watching and they see, you know, different agencies partnering and taking action, it inspires them to start to take action. And I think overall, you know, it shows everybody's resilience and ability to rise to an occasion. And, you know, when you see people that are taking that action, it instills confidence in you that, okay, we're gonna be okay. We have people watching over us, and then I can help, I can take part, and I'm gonna be okay. And I think it just gives us hope to see people coming together, working together, partnering together, that hope that we can make it through something like this. And everybody brings their expertise to the table.
So we lead by example to give people hope. Yeah, because hope gets you out of bed in the morning. It does. It does.
And I think collectively, if we grieve as a community, if we hurt as a community, it's important for us to demonstrate that we can heal collectively. And there's such a thing as collective healing. And during this process, I see our people really strengthen because of that collectiveness and being empowered to know, as Dr. Powell was saying, just knowing that we can do this together. And there's a whole generation after us that is looking and understanding. We're also teaching them how to approach crisis. You're not alone. We're here together and we do more together. So let's get together.
I think it strengthens, it spreads the resources. It strengthens the resources rather. When one community or one group comes together with what they have and the other, so it brings the strengthening in the resources. And it also spreads the respect, because as we have all stated to some degree, when we see others coming together and getting along, this pandemic had no respect of persons. It affected any and everyone. And so just seeing that collectiveness and collaboration, I think it also brings that respect in the community. And then the community responds differently when they see that. And so we're gonna get past this pandemic, but something else is going to
Come along, yes.
And so we need to have that embedded in us, that community can come together.
Right.
I definitely think that we have to look at it as a house that we're building, and the house being something common. And each person in building that house brings a certain resource to it. Your plumber, your electrician, your
Wonderful.
roofer, your mason.
Yes.
And you cannot build that house
At all.
all of them. You won't have a bathroom. You won't have a driveway.
Right,
You won't have lights in the house.
right.
And sure, you can have the house without the bathroom, but then you're going outside. And that's backwards. And I think we are going forward
Yeah.
as a community. And if we're truly going forward, we're going to have to come together
Yes.
because, as they used to say, united we'll stand,
Yes.
but divided we will fall. And that's what we
And
got.
shouldn't we still be saying that? It's
Yes.
funny that you should
Yes.
say, as they used to say, because there's
Yes.
such division
Oh, yeah.
among us. And
We're
there's
changing.
no need to be.
And it's time to change.
It's
And I
time
see
to
we're changing that. This pandemic changed
Yes.
that, and we have to keep on that trajectory. We have to keep on that direction and not take 2 steps back.
Yeah.
Regardless of what certain groups may like to do.
Exactly, exactly, because as Dr. Steph said, something else is gonna come along, and we're teaching the children for the future. So we have to maintain and keep doing these things so that they can learn, because they are gonna need to know how to do it when it's their turn. Something else is gonna come along, and they are gonna need to learn to do it. That's it, ladies. Thank you so much for joining us today. Congratulations. Let's give her some. Thank you. I'm so glad you tuned in today. And thank you so much for tuning into this very special edition of Live Healthy Miami Garden Facebook webinar, Women's Health Month. And these are our health champions, our Miami Gardens health champions. Congratulations. We love you. We appreciate you. Thank you for coming in and sharing all of your wonderful knowledge with us and experiences. Keep following Live Healthy Miami Gardens. They're here for you. If you need anything, go to livehealthymiamigardens.com. Learn everything you need to know about vaccines, flu shots, and everything else that the city has to offer. Thank you. Don't forget to stay tuned. We have a webinar coming back for you every month. Stay tuned and follow us on Facebook, follow us on Instagram. Make sure you go to YouTube. If you have questions, put them in the chat, put them in the Facebook, and someone will get back to you. Thank you. Have a great night. Stay blessed.
Thank you.
Yes.
Now.